if I have a daughter, when should she get her first pap smear?
The recommendation, 21 years old.
21 years old.
What
But
if she's sexually active
21 years old.
at the age of 15?
so let's make sure we're understanding though. She should get a pelvic exam. We can actually examine women and look at their vagina and look at their cervix. You can actually get a physical exam of your vagina and pelvis at 18. Okay. Now, but we do want to actually do a cervical exam and actually test for cytology at 21. So that's a lot of times people confuse this. So the PAP versus the actual looking at the vagina. Looking at the vagina, looking at the cervix, testing for infections, testing for sexually transmitted infections is two different things.
I want to
Still, recommendations though, start pap smears at 21 years old.
For cervical
answer
cancer
this question
screening.
about, if I have a young daughter who is sexually active, that's where the HPV vaccination comes in. So they recommend HPV vaccination as a way of preventing virus infection that is strongly associated with cervical cancer.
And again, just understand that there are hundreds upon hundreds of types of HPV, and there are hundreds that are associated with cancer. Now, in the United States and worldwide, HPV types 16 and 18 account for 70% of cervical cancers, right? So, with that said, the vaccine is only targeting two of the high-risk HPV virus, right? So, it's not an end-all, be-all.
You still need
your screening.
Your screening. You need a pap smear, and you need somebody to be looking in your vagina.
But
Jocelyn and Mark,
Yes.
here's the deal. If a woman comes to and I'm not trying to be callous here, I'm just trying to play devil's advocate.
Yes.
If a lady comes to the ED with vaginal bleeding and they have stage 3 cervical cancer,
Yes.
number one question is, what is their chances of healing successful? And two, do you really want to blame the ED for that delayed presentation?
So the harsh reality is this, and this I'm very sensitive to the disparities, but not everything is just blamed on systemic racism or whatever have you. Whatever, it's not those ED docs' fault, right? I understand the ED, they're inundated with a bunch of patients. They see a lot of vaginal bleeding, and yes, they may have overlooked it. But the cervical cancer was there for years.
Yes,
If it's
a
stage 3, it's
slow
been there
growing.
for years. Something just reached a point where it started bleeding a lot. And cancers can bleed.
And this is the importance of what we do, is having as you go to your doctors and your specialists, having a physician that's your primary doctor, your primary care, your obstetrician, gynecologist you see every year that you maintain a relationship with, that you're comfortable with. Sometimes women they don't get comfortable, they see another doctor, they go to the ER, they go to this specialist, and they're not having that relationship. And so with our, even our individual practice, we see women years after years, we know them, and we can say, hey, you haven't had a pap smear in a couple years, or we want to have these relationships with these women so that they don't get lost to the system. And so we do encourage anybody that's watching, have a relationship with your OB-GYN, your primary care, so that and be comfortable with them. If you don't trust them, find another one, so that you can be comfortable, because your preventative visit is not the emergency room. It's not the specialist.
Right.
We're the ones that are gonna help you live a long, healthy life, because we're helping you with your preventative care.
So definitely there's a lot of fake news about vaccination. However, cervical cancer is a real problem.
And it's still
I'm a father
affecting-
of a 21-year-old daughter and an 8-year-old daughter. I'm having a conversation with them about both pap smear and HPV vaccination, and I will strongly recommend that all ladies out there, please get with we have 2 amazing OB-GYN doctors here.
Please.
Give them a call, educate yourself about this problem, and please get yourself checked before something bad happens.
Yes, I think that when we look at what could have happened, the worst case scenario is, let's say she did go to a doctor routinely and there was a abnormal pap smear and it was just ignored year after year after year, then that is just malpractice, right?
Right.
That's highly unlikely.
Highly unlikely.
unlikely.
Highly unlikely.
I find that highly, but it's
Also, cervical, I mean, I'm a GYN. If a patient's coming to me for her annual exam and pap smear, I mean, I've diagnosed
Right.
cervical cancer once I got in the vagina, and I'm like, oh my God,
Or
what do I have here?
What could have happened? I mean, what I would suspect, like most people, I would say a lot of people don't have insurance. So they don't want to go to the doctor. They end up going to the doctor when they have a problem. Where do
Yes.
they go? Urgent care, emergency room.
Right.
What is the purpose of urgent care, emergency room? They just to stabilize.
Make sure you're not dying.
Stabilize.
they don't do pap smears.
Right.
there.
Stabilize it. Here, you need to follow up with your doctor. And then maybe it stops, and then they go back to the ER. And the same thing keeps happening over and over again. The other thing is, like, some people don't have access to health care. Like, we say, go get these preventative screening tests, but I mean, how many of you know someone who doesn't have a primary care doctor?
I would also speak to a real truth, which is we have patients that have insurance and whether they're pregnant or not, and they just will not come in for their visits. So what we'll say is this, was the ED docs, we're assuming this was in the emergency department, okay? They're not to blame for the cervical cancer. It was there for years. It just presented itself that way. And the reality is it wouldn't change the outcome, unfortunately. Now, with that said, for all the ladies out there, take care of your health. Make sure you go see your doctors. Make sure you advocate for yourselves. And just be seen. Be seen. Get your annual exams. What Jocelyn said is important. It's all about preventative care. Once it reaches stage 3 cancer, pretty much virtually all cancer, if they're stage 3, there's not much we can do about it. So
Right.
again,
It still is possible to have a cure rate, and at that point, cervical cancer is treated non-surgically.
It's chemoradiation.
It's chemoradiation, and there are things to do. Unfortunately, with her, she did not survive, and it appeared to be healthy. But I know we do got to get to one more topic at least.
well, okay, so again, let's just, encourage preventative care so we don't have these tragic outcomes.
Yes.
Okay?
Yes.
There we go.
Perfect.
All right.